Thank you for joining. I'll go ahead and get us started. I'm Stacy Stanifer. I am an assistant professor in the College of Nursing and the Community Engagement Corps co-leader for UK CARES. So today we're going to talk about or offer you an informational webinar for the community grants that will be soon released and we're excited about. So we'll get started. We like to start our meetings with UK CARES with the land acknowledgement. So I'd appreciate if Kelly could read this for us.
Sure. We recognize the land to express gratitude and appreciation to the traditional stewards of the land and to honor the indigenous peoples who have been living and working on the land from time immemorial. We honor the historical and cultural influences of more than 20 tribes in Southeast Kentucky, including the Cherokee, the Chickasaw, Chippewa, and Shawnee, among others.
Thank you, Kelly. So this is what the agenda for today's meeting is going to look like. We'll introduce you to the UK CARES team and review the mission and purpose of the community grants, review the RFA, and then have some time for question and answers at the end. Julia, it looks like right now you are our only attendee. So if you have any questions as we go through the slides, feel free to unmute yourself and ask questions, or you can put them in the chat or wait till the end, whatever you would like. We'll keep it a little informal. So on the slide, you can see who the UK CARES team members are. We are led by Dr. Ellen Hahn and Dr. Erin Haynes, and also Kara Richardson. She leads us as well as our center administrator and keeps us all in line. Our community engagement core is co-led by Dr. Mark Dignan and myself, and then Kelly Knoy is our program coordinator, and it's a huge asset to our team as well. We also have our wonderful pilot project program that is led by Dr. Tom Curry, and we have Dr. Joel Thompson and Amy Thomas who are on the call as well, who are the research development director and the administrative coordinator. So they're also very helpful with this grant process. So you can see on the slide here, this is the UK CARES strategic vision. We have the vision of reducing health risks and disparities in rural Appalachia through novel environmental health research. And our mission is to discover and translate research on how the environment affects the health of people in rural Appalachia. So we really have, you can see a real health component all throughout. We really value our community partnerships. We certainly cannot do the work that we do without them. And we also value health equity, responsible conduct of research, and team science. And you'll see that kind of weaved in throughout these community grants. We do have some science themes that we have found through our community environmental health assessment are really the biggest concerns of the community members in our region, and that involves water, indoor air, outdoor air, and then emerging threats like climate change, flooding, and emerging infectious disease. So the real purpose of our community grants is to support community residents and organizations in Southeastern Kentucky grow partnerships with UK faculty to engage in citizen science by exploring how exposure to environmental contaminants and emerging environmental threats affect health, prevention, and treatment of environmentally induced disease. And you can see group of some of our folks that we've worked with in the past on previous projects with these grants. So who is eligible for these awards? It's community organizations that partner with at least one UK faculty member. Examples include nonprofit agencies, schools, health departments, and if needed, we can help with assisting these community partners and organizations with identifying a UK faculty member that can help meet that expectation of partnering with a faculty member. The role of that faculty member must be must be specified within that project. So whether they're going to help with survey development, data analysis, that needs to be specified within the application. Those in the Big Sandy, Kentucky River, and Cumberland Valley area development districts are eligible to apply. And then the funding is up to $10,000 plus indirect costs to address one or more of the priority areas. And the organization can use their federally negotiated rate, or if they don't have one, they can request a maximum of 10% per uniform guidance to provide a service to the public by supporting community engaged environmental health projects. So the applications are going to be due on July 18th, and then we'll have a panel, a review committee review those, and applicants will be notified on August 15th. And then the project implementation period will be from August 15th until March 31st of 2023. Any questions so far about that?
Not so far, thank you.
Okay. So the award priority areas include those in climate change, environmental justice and racial equality, access to safe and quality riverways, air quality, arts and environmental health promotion, environmental indicators and impacts on heart and lung disease, cancer, diabetes, child health and early life exposures and substance use disorders, environmental risk communication and health literacy, exposures to metals in either soil or water, hazard and disaster response, healthy homes, water quality, and youth and adult engagement in citizen science. So outlined here are just the 21 county area that fall within those 3 area development districts. So any of community organization, local health department, healthcare entities, nonprofit agencies, and schools within this 21 county region can apply. And some past examples are listed here. So we had a grantee is a science teacher, Mr. Craig Wilmhoff at the Perry County Central High School, and his biology students collaborated with Dr. Anna Hoover from the College of Public Health on a project called Efficacy of Utilizing Citizen Scientists in Monitoring School Bus Air Quality and Absentee Rates in a Rural Appalachian Public School System. Alice Mant from Watershed Watch of Kentucky was partnered with Bill Ford from the College of Engineering, and their project was incorporating social media and citizen science into a water quality improvement project. And lastly, another example is we had Nina McCoy and Ricky Draper from Martin County Concerned Citizens partner with Dr. Jason Unrein from the College of Agriculture, Food and Environment on a project called Connecting Science and Citizens to Improve Water Quality in Martin County. So in the application, when you fill this out, there'll be sections in there for you to put your title of the project. You're going to identify who the target population will be, and then put in there what the project goals and timeline is. So what is it that your organization wants to know and why? And this is your introduction, your purpose, and your goals. Then you're going to talk about how you're going to achieve those goals. So the approach and need for the project. So what will you do to answer these questions? And then an evaluation plan. So how are you going to evaluate your findings? And then there'll be a community report back plan. So we ask that everyone at least develop and share how you may be, how you think you're going to be sharing these findings back with your community. So report back to the community is an important aspect of these projects. And so we just want to hear how you'll share those back, whether it be social media, maybe a newspaper article. What are some other examples that we've seen, Kelly?
For report back, all really various types of things, you know, community meetings, sharing with our SAB, and our KEC
Thank you.
as well.
All right. And then lastly, there'll be a section for you to fill out the budget and also for you to provide a detailed justification. And there are templates available for download for when you're filling those out. So some of the project requirements is that you develop and implement a project that addresses one of the priority areas. And again, those have to do with water, air, and emerging threats that contributes to environmental health science. So there really is a health component to these. Coordinate with at least one UK faculty member. And if you're in need of some help with identifying who that faculty member might be, we can do that. You're going to be asked to provide a written monthly status summary, and Kelly will be the one that'll be working with you to coordinate that. But we like to just have a progress report monthly on how your project is coming along. And then at the end, we require a 3 to 5 page summary project of that report. So what did, kind of going back to your application of, what are you trying to achieve? You'll just kind of answer those questions again and through an evaluation. So what did you want to know? Why did you want to know it? What did you end up doing and what did you find? And then what does this mean for the health of the community and how are you sharing these results back with the community? And so again, that community report back plan is important. Some of the funding details are outlined here, and the participants' organization must be a 501c3 status or a designated lead fiscal agency, like a health agency or a nonprofit, to receive and manage that monetary award. You must have at least one University of Kentucky faculty collaborator on the project. And if needed, again, we can help identify who the best faculty collaborator might be. And that role of that collaborator has to be specified and within the project. Allowable costs, so funds are to be used for the conduct of the project. Successful applicants can receive up to $10,000 to cover a portion of personnel salaries, supplies, in-region travel, and other costs to complete the proposed project. Other costs may be deemed unallowable per the award that we've received UK Cares through NIEHS and other federal guidelines. So if you have any questions about what those other costs may be and whether they're allowable or not, reach out to us and we can answer those for you. And then cost share is an allowable cost, although not a requirement. So invoicing, unless detailed otherwise in the subaward agreement, invoices should include all of the following here. And we prefer that invoicing occur either monthly or quarterly throughout the project, but the invoicing deadline is no later than March 31st of 2023. I think I went through those very quickly. Do you guys have any questions, Maggie or Julia?
Hi, Stacy. This is Julia.
Hi.
Hi, thank you so much. This is really interesting. I'm a faculty member over in anthropology and part of UK Cares. I just to introduce myself in case you didn't know. And so I, of course, am super interested in community-based research. So I was logging in today to sort of, just learn more about this. And so one of the things that is a challenge for me right now as a newer faculty member is connecting with community organizations and community members that might be interested in doing some work like this. Yeah. So I was wondering if you might have any guidance as to how someone without deep connection, community connections might go about sort of, starting to forge some relationships. So
absolutely.
be in a spot to sort of apply for this kind of funding.
Yeah,
Maybe not this cycle, but maybe, maybe in the future. I'd love to this time around, but I don't know if that's really feasible.
yeah. So Julia, what we can do separately is have a separate meeting with you, Kelly, myself, and Dr. Ellen Hahn, and talk about your area of interest, and then who in the community we could partner you with for, to help you meet your objectives. So that's one of the great things about the Community Engagement Corps is that's one of the things that we do is make those connections with researchers and those within the community. These grants themselves are for the community organization to apply for, and we do have different funding through UK Cares for faculty members, but we can certainly talk about that and help you make those connections.
That would be great, because
Yeah.
that's something that it's just been challenging, and so
Sure.
and with COVID and everything, it's been really challenging.
Yeah, absolutely. Yeah, no,
For-
we're happy
yeah.
to do that.
Oh,
Yeah.
thank you so much. That'd be
Yeah.
much appreciated.
Does anyone else on the call from UK Cares have anything they want to add to the presentation that maybe I didn't emphasize enough? Or
No, it's just we'll walk people through the process as we go. And I follow up with people monthly to see how their projects are going. And if you have any questions, you can always reach out to me or Kara or Stacy. I'm the point person for all the field work, after the award's been issued, but we're here. And Julia, I have to say, it's great to see a faculty fellow on this call. We will definitely try to hook you up with community group.
Hey, Kelly, it's nice to see you again. No, actually the project that I would love to find a community partner is that wristband study that, that I don't know if you remember our pitches during the science communication fellows program, so that I'm really, eager to make that kind of, come to fruition. Sorry if I muted. I think I muted myself if I'm on a different device.
That's okay.
Today.
That's all right. Well, I'll reach out to you and we'll plan another meeting.
Great.
Maggie, do you have any questions? Check the chat. Yeah, Julia, Kara put some other UK Cares funding opportunities in the chat. I'm not sure if you're able to see those in there.
Okay, thanks. I will take a look.
And this is Kara, just to mention the funding opportunities. The two that we have open right now are the community grants that this webinar is about, and then which does have like a close and end date, a little bit more restrictive. But the rapid response funding is open and it's on a rolling basis. So as applications come in, they're reviewed, and then we set a meeting, and I think Joel and Amy and Dr. Curry and our team evaluate everything and go forward. So there's funding there for us, and hopefully the hard and fast deadlines for next year are March 31st, 2023. But the fact that it's a rolling basis, you can apply anytime, but the funding will end in March. So the sooner the better on any of those rapid response grants.
Thank you for the information. Thanks.
Okay. Next steps, Kelly, if we don't have any further questions.
Yeah, I think that's please apply.
Yeah. Yep. Please apply and tell others. So
Right, spread the word.
These projects are really a lot of fun and great to see come to fruition.
Yeah, it's great to see this kind of funding. It's very exciting.
Good. All right, well, that concludes, I guess, the presentation. I'm happy to stay on for a little while longer if anyone thinks of any questions, but otherwise, thank you for joining us this afternoon.